Hi, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, February 5th. Welcome, and welcome to Ed Brubaker, our Living Branches President and CEO. Nice to see you. You're wearing a very attractive shirt there.
Yes, thank you, Alex. Good to see you as well. Yeah, these are our COVID vaccine T-shirts for staff because we want to continue to encourage staff to get vaccinated and proudly wear their shirts to say we have been. So Fridays, from here till whenever we decide not to do it anymore, we're going to be wearing our I got the COVID vaccine or checkmark COVID vaccine T-shirts. So it's another way to show people that we've done it as staff members, but also to encourage other people who may be on the fence and may want to talk to somebody who had the experience and what was their experience. So.
Yeah. So you get these after your second dose. So by next week, we'll have a fair number of people who will be supporting them on Fridays. So let's talk about where we are with our case count. Happily, I don't even have to have it written down because right now in Living Branches, we have one person in all of Living Branches who's testing positive, and that person is a resident in Oakwood Court. But other than that, knock, knock on wood, as of right now, we don't have anyone else, which is very encouraging.
Yeah, the interesting thing about that particular situation, too, was that we then had to go into protocol testing for our staff and for our residents. And to date, we have not found any other positive. So it begs the question, how did it get in? Because we're also not aware that she had been out to physician appointments or anything like that. In theory, it may have been a false positive, and we're not sure about that, but we're going to be doing some testing, I believe it is next week, that would be earlier than we typically would, just to kind of check that theory to see if it was because it was an antigen test. But that is kind of the head scratcher, but that can happen sometimes with this disease that there may have been an exposure either you didn't know about or a latent exposure that took a while to work itself out of her system or whatever. So we're still exploring that, but the headliner is one person in all of Living Branches and no staff persons who are positive. We have some that are out of work because of exposure, but no current positive. So that is really excellent news. Obviously in the spring it was a challenge. The summer and fall, early fall tended to track downward, and then of course with the holidays. But now we have the vaccine as well, and we do believe that that's making a difference also. So it's some positive news, but we've still got a way to go.
Yeah. And maybe just to clarify with our resident that we have seen cases we've believed before have been false positives. But in this case, she does have symptoms. So that would seem to make that less likely to be a false positive. So I'll be very interested to see what the test reveals.
Yeah, that's true. Although when I did quiz our infection control nurse and also our medical director, they indicated that there could also be other diseases that could have also mirrored some of the symptoms. So yeah, we're just not exactly sure what was going on in that situation. But wow, one in all of Living Branches, that's pretty amazing.
Well, now that we've talked about the fact that our cases are dying down, we're working on vaccination, the question on everyone's mind is, of course, when can I come and visit? And so there are there's actually, that's a pretty complicated question. There's a lot of different aspects to that. Maybe we should start with the easy one. Let's start with residential living and talk about what we're doing for visiting there.
Yeah, and with residential living, kind of the threshold we're looking at is the 5% positivity rate in the county, Montgomery County. And so it is dropping, which is a positive sign. So I would hope that if it would continue to drop, sometime in the next few weeks, we could change that again. I would also say that we'll need to pay attention to other data points as well. So if that becomes problematic or it feels like it is safe to do some reopening, because we do look at residential living a little bit differently than we do at our personal care and healthcare facilities. And partly because it's not regulated in the same way. So that is the magic number we're watching, is the 5% positivity rate in the county. But it is dropping. But we'll continue to monitor that in the next weeks.
And then with healthcare, personal care, and memory care, we are in general looking to get our common space visiting program back up and running again. And that's something that we're striving to get that going next week. It's a whole lot easier to shut it down than it is to start it back up again.
Yeah, that's right. And you have to remember that there's expectations from the state too, as to from a regulatory standpoint, as to monitored visits and those kind of things. And so we have to have staff available for that. So it does become a challenge to start that up again. And that's really what the staff operations teams are working on now. But you have to think about it too. The last time we did that, we didn't have, I don't know how many, we had 15 or more vaccination clinics. So that's going on right now too. So there's a lot of different things that need to be attended to. Testing is going on. We went to twice weekly testing, which wasn't happening the last time. Now, fortunately, next week we can go back down to once a week testing of staff. But, there's a lot going on, and we did form a testing team so they could take on some of those responsibilities. But you can't just easily ramp up all these staff people because, frankly, the hiring market is still kind of challenged out there. And so, that's really some of the challenge we're dealing with. But we absolutely want to move that as quickly as at all possible, even given all those things, because we recognize how really vitally important that is.
Yep. And we are piloting something new at the campus, our small campus, the Willows of Living Branches, which is our campus in Hatfield, of course, that's personal care only. And sometimes because it is smaller and just one level of care there, it is a great location to pilot things. So you were speaking of testing, and we're using the Willows as an opportunity to pilot what we're calling a guest program. So maybe we should talk about that.
Yeah, sure. And I know you've been intimately involved with the creation of that, as well as some other operational folks as well. But the idea behind it really was to allow opportunity for visits in a more relaxed and familiar setting, meaning your unit. But you obviously need to make sure your safety protocols and your positivity rates in the county and all those things are at the appropriate place. So it's really kind of exciting to see, because it will allow guests to see their loved ones in their loved one's apartment. And so there's obviously things that we need to put in place, and we are putting in place. We have testing protocols. It's not going to be everybody. It's, I think, up to 2. So there's details that are, it's not a total opening of the campus, but it is doing something different than we've done in the past, trying to be creative, but still put things in place to make it safe. Because while we feel we're making nice progress with vaccinations, and while we feel our numbers are going in a good direction, you just heard about that, the reality is the wider community, it's still very much out there. In fact, we still have staff getting exposed to their spouse or family member, and so we haven't gotten anywhere close to herd immunity yet. So we still need to proceed with caution, but I think it's very exciting to be able to be here because it is just so incredibly important. We're also trying to do more with our compassionate caregiver program, which is something else we had started last fall, and then we had to put a stop to that because our rates were going up, both in the county and within Living Branches. So that we're revisiting too, and I know specifically in Oakwood Court, they're doing some work at that and other places as well. So it feels like there's some nice opportunities and some hope on the near-term horizon, but also on the longer-term horizon as well.
I was joking with my husband a couple days ago, saying, thank goodness the Eagles are not in the Super Bowl this year, because now no one needs to have a Super Bowl party. So I do think it's interesting that, we looked at Thanksgiving, we looked at Christmas, we had, even though we were being advised not to, many people, of course, still went and saw family. There were gatherings. Well, now we're weeks past that and the rate's starting to tick back down. But here we come up to the Super Bowl and another reason for people to get together. So It's not the Eagles. It doesn't matter. Maybe everyone needs to remember, do not have a party, please.
Well, and I suspect a lot of people, though, might want to watch Tom Brady lose.
That would be beautiful.
But we'll see what happens. But yeah, you're absolutely right. I mean, I don't know where the Super Bowl ranks in terms of holidays. It's definitely above Valentine's Day, and it's probably closing in on Thanksgiving too. I mean, it is a time, I know we always, in the past, not this year obviously, joined friends for a Super Bowl party. But yeah, so that is something that hopefully people won't be doing even to watch Tom Brady lose. But the point is that, yeah, that's a good thing that the Eagles aren't in. I agree with that, because those kind of things do become spreading events, and we need to pay attention to that. So, yeah, we're hoping that we'll continue on the trajectory we're on.
Yeah. Mm-hmm. Well, our question this week is actually from future residents. About 30 future residents. I've been getting calls and emails about this for a while now. And they're calling to ask us, can I please get my vaccine at Living Branches? We see you're vaccinating your residents. How about us future residents?
Yeah, I think I'll probably have to start with the quick answer so people get that, and then I'll go in. And the quick answer is, unfortunately, no. We don't have the opportunity to do that. We were able to work with people on the future resident list who are moving in very shortly. So that's a different category. But the future resident list in general, no. Having said that, we do understand the Biden administration is looking to distribute the vaccine more through pharmacies. So a few weeks ago already, I'd reached out to our pharmacy, and I want to follow up with that. And so if there were ways for us to do it, either for us to coordinate it, although that does become costly and a logistical challenge too, and do we want to bring people on our campuses? But if there may be other ways that we could help coordinate this too. But I would also encourage persons in that category to look for places they can do it. I know Lehigh Valley, St. Luke's, various other places had been signing people up. But certainly if there's a way that we can find a place that we could steer people to or create something, we're certainly open to that. But right now, unfortunately, we don't have the ability to do that.
Yeah, and that's not us. That's CVS. That's our vaccination partner. So there's not really, and believe me, we've tried, but there's not anything we can do about that. But that does lead to a great question about new move-ins. So we've reached out and talked to people who are scheduled to move in next month, maybe. They're just finishing up their turnover. And so we're able to offer them the vaccine. But we are working hard to identify how are we going to continue to be able to vaccinate people 3 months, 6 months, 9 months from now, if that's something that we need to do.
Right, exactly. And it would not just be new residents moving in, but new employees who are coming into work for us too. So yeah, that supply chain hasn't been worked out yet. And I know with the I guess it would be the J&J vaccine that is looking to get approved with one dose. Now, it seems like the efficacy isn't quite as good as Moderna or Pfizer, which we're doing Pfizer, but that could be an opportunity too, because again, it still helps us get to herd immunity, and it still is better than nothing, and it still is a very good efficacy rate. But I know from myself personally, I'm appreciative of the fact that our organization and me personally got the Pfizer vaccine. I mean, I guess I've been thinking about that again recently, that, when you think about the world's population, I don't know, it might be 1 or 2, or let's say 5%. Yeah. I don't know, it's 5, but it's a very small percentage that have gotten the vaccine. And when I think about that reality, like, why was I? Well, I know the technical reason why I was. I work for an organization like Living Branches. But the bigger question is, why? How did I happen to live in the U.S.? And, when you read stories about sub-Saharan Africa who may love to get the vaccine and may or may not ever get it. So honestly, part of the reason I got it, in addition to living here, is it's with gratefulness that the scientists have been able to do that. And I really hope that residents who maybe are sitting on the fence or staff persons will really kind of take time to study it, I'm amazed by the science.
Yeah.
Look at it and study it, and then gratefully put up your arm and say, yes, I am grateful. I am thankful that I can. And I'm thankful for the scientists that have worked on this so hard on our behalf.
Yep. I'm actually getting really emotional as you're talking about that right now, in part because today one of my dear favorite residents is at end of life, and we can't go visit her. And she's, she doesn't have COVID. She frankly is thrilled. If she were conscious, she would be thrilled because she wants to go see her husband in heaven. But we have got to get things back to normal.
That's right.
And if this is a gift that we can do that.
And I see it as each of us, honestly, having a responsibility, a sacred responsibility to do it on behalf of those we serve and each other and our families and our loved ones. I really do believe that way. And I know not everyone sees it that way. And I will respect that, but I will not ever stop preaching it as the CEO of Living Branches.
And I think, well, when you look at the number of our people who've been vaccinated, the vast majority really are feeling, I think, this exact same way.
That's right. And we're just under 73% of staff. And I think depending on the facility, it's anywhere from 90 to 100% of residents. And while that's not the same, nor is it 100% for either one, those are very good numbers. And when I hear colleague CEOs talking about 25% of staff, 50% of staff, 60% of staff, I'm proud of the fact that we're at 73. Yeah. Now, I want to get to 80 and beyond, but I'm still pleased where we're at. But I really hope we can continue to raise that number.
Yeah. And when I do talk, I've been out practically dragging people to the vaccination clinics. I think people are starting to run the other way when they see me coming now. But as I'm out talking to our team members, for so many of them, they just want things to be back to normal for residents.
That's right.
So, I think that's our overwhelming theme, if you will, right now.
Yeah, absolutely.
And we really are making progress. So by next week, for personal care, memory care, and health care, all residents who want them will have had their second vaccines. So we're making good progress there. Satterton Residential Living is having their first clinic today. Doc Woods Residential has their second clinic next Thursday and Friday. Doc Manor's having their second clinic next Friday. So by Valentine's Day, the majority of our staff and residents will have been vaccinated.
Yeah, that's right. It still will take a good amount of time to get to normal. We still need to mask up. We still need to maintain distance, but we are absolutely making progress, and that feels very good.
And we should also say, because I have already received a lot of emails about this, we cannot reopen our campuses for healthcare, personal care, and memory care until we get clearance from regulatory agencies. And that's not here yet.
That's right. And they're studying data, but they're, I would say, proceeding with caution as well, because they're also paying attention to not only what the vaccine rates are within our community, meaning Living Branches community, but also in the wider community. So it's going to take some time yet.
Yeah. Final thoughts?
Final thoughts. Well, here's a final thought. If you're an Eagles fan and you remember when Andy Reid was the coach of the Eagles, if Andy Reid was still the coach of the Eagles, would Patrick Mahomes be our quarterback? And would we be in the Super Bowl? I don't know. Perhaps yes, perhaps no, but it is an interesting question because we seem to go through some personnel with the Eagles more quickly than others, and some would say there's other personnel that should move on from the front office too.
As my final thought, I will say, please do not email me or call me about this final thought, as I have to hear it at home all the time. So I do know what the official MetroCarty theories are regarding that, but to spare our audience, I will not respond. It will be interesting to see what happens. Here's to a Tom Brady loss. How about that?
Although you have to admit, he has been an amazing quarterback. I mean, he's 43?
He's
it's amazing.
Yep. So, all right. Well, thank you. It's nice to talk to you. Thank you, everyone. Again, if you do have questions that do not involve the Eagles, please feel free to email coronavirusquestions@livingbranches.org or visit our website. There are links there. Thank you so much.